And welcome back to Health View. This is Dr. Angela Ruff, and again, our guest this morning is Dr. Richard Weisler. And we are discussing post-traumatic stress disorder.
Well, Angela, to continue with what we were talking about in terms of military mental health problems and issues, what we know is from recent surveys of veterans that have been done, what they found is in the last 30 days, they found in these surveys that about 14% of people who had returned from deployment had symptoms of post-traumatic stress disorder. And around 14% had symptoms of what we call major depressive disorder. And then there's another condition that's been in the news a lot lately and people have talked about, which is called traumatic brain injury, that they may be at risk for that. And that rate was 19%. And it turns out that roughly 300,000 of these 1.64 million people who served have experienced post-traumatic stress disorder or major depression. Sometimes people will have both. And then about 320,000 who came back had experienced a probable traumatic brain injury during deployment. And a third of those, roughly, have traumatic brain injury and either post-traumatic stress disorder or major depression. So those are pretty big numbers. You know, over 120,000 will have both traumatic brain injury, probable traumatic brain injury, and PTSD or major depression. And as it stands, a lot of people who met criteria for PTSD, like what we just talked about, or major depression, which would be where you feel sad, not motivated, have trouble sleeping, may feel hopeless, may have thoughts of suicide or be suicidal, trouble concentrating, being more worried, low self-esteem, those kind of things. About half the people with post-traumatic stress disorder or major depression in this big survey the RAND Corporation did had not sought any help from a mental health care provider within the last year. And with the traumatic brain injury cases, the number was around 57% had not even been evaluated.
Wow.
So those are big numbers. And we know, like most areas of medicine, or for example in dentistry too, you want to catch things early. There's usually not a lot to be gained by waiting a long time to deal with medical problems. You suffer, families can suffer, and these really are what I consider to be treatable problems. But they require treatment. It's often a combination of working with the individual, sometimes working with family members, because, we talk about the veterans, but for family members who are very concerned about loved ones or things like that, they can have post-traumatic stress disorder too. And again, lots of people, unfortunately, have been, had past experiences where maybe they were assaulted or been in automobile accidents, may have been, sexually assaulted. And so the vulnerability for post-traumatic stress disorder can actually go up sometimes. We also know, like I mentioned, there's a concern about suicide, and often when we look at suicide, what we know is that 90% of people who die by suicide have a diagnosable mental health problem, and most of these are treatable. And the important thing is, again, for people to recognize a need for treatment, or family members to recognize a need for treatment, and to get appropriate help. In the military, one of the problems as well is that all of the long deployments and things like that can sometimes cause problems with, personal relationships or legal or financial problems and stress at work, and that can be a factor as well, with making people feel more distraught, more hopeless. But again, people need to seek out treatment. There's also can be a fear that we hear sometimes from people who are serving, and sometimes from their families, that they're afraid if they come forward and seek treatment that they'll there'll be consequences or repercussions, so they delay. And that's probably why the numbers I was telling you before, where about half the people with traumatic brain injuries or depression or PTSD don't seek treatment.
Right.
Those are, unfortunately, very big numbers.
And unfortunately, a lot of insurance companies kind of look at that to see if they've had some treatment for this before finding out if they're insurable.
Right, and that certainly can be the case. And but at the same time, the most important thing is to go ahead and get treatment and find other options. And we know the VA, for example, treats lots of people. A recent study that came out in the last year or so, they looked at 807,000 veterans who were being treated for depression. So that's a lot. That's a lot of people.
I thought it was really interesting where you pointed out that the different wars, the increase because of the safety and armor, then you have more survivors, and so that's why a pretty good reason why you'd have more cases of post-traumatic stress disorder, because you just have more people surviving the trauma.
Yeah, and I think the other thing that's improved as well is the medical care, the ability to air vac people and get people appropriate treatment medically very rapidly, in addition to the body armor, has made a big difference. I think the military's done a good job in that regard.
Right.
But if you look at veterans who felt suicidal, it's often related to current or chronic PTSD, post-traumatic stress disorder. And again, that is something that is treatable. But depression can be there too, and sometimes people will have bipolar disorder. Unfortunately, we see a lot of people with depression and PTSD, whether they have a military background or their PTSD or some other cause, will decide they're going to self-medicate. And so what they'll do is they'll drink. Sometimes they'll throw in other drugs. But they may stop exercising, things that we know do really help. It's important to get all your basic systems working well if you have PTSD. So you want to exercise normally, preferably walk, if you can, at least 11 to 19 miles a week. You want to try to sleep right, eat right, surround yourself with friends or people who care, and that can make a big difference. But despite that, most people with these conditions do need to talk and maybe get some therapy. Cognitive behavioral therapy for post-traumatic stress disorder, Angela, can be very, very effective. And
then I guess there's pharmaceuticals also that could help them.
Yeah, pharmaceuticals can make a big difference as well. We'll talk about some of those in just a minute.
Sure.
But they really do make a big difference for a lot of people. But what you have to be aware of is, going back to your earlier question, is there any biology in this? When people, have a threat, certain sections of the brain have been programmed to try to help us respond. So, for example, in the area of the brain, the sensory cortex, prefrontal cortex, there's a memory of things, and you might have emotional aspects that'll be triggered in another area of the brain, the thalamic area. And then we have the amygdala, which kind of gets things going and will raise the heart rate up, maybe work on breathing, and maybe functions like endocrine functions as well. And that creates a fear response. And so with a lot of people, when this fear response happens, they're able to process it and look at things differently, and other people, especially, for example, like in the hurricanes, what we found is that the middle-aged people had a harder time often adjusting than older people. 65 or older did better than a lot of times the people who were in their 40s and 50s.
Why was that? And
part of that was that they'd been through experiences before, the older group, where they've had losses, and they've learned how to cope with them. So that's partly it. Doesn't work that way all the time. And then the the other part is that a lot of times people and you know, middle-aged or even young adults with families, they have a lot of balls to juggle. You know, they're worried about working. They're worried about raising their children and being a good parent. They're sometimes having to take care of parents themselves who are having health-related problems. So they have a whole lot of things going on at one time, and that may make them more vulnerable. And then also children. You know, we tend to forget how this impacts the children as well. You know, if you've lost a parent, or you know, in an accident or some other kind of trauma situation, or if you yourself went through that, it can be very, very hard too. So they have a vulnerability. They recover a little bit faster.
So the cognitive therapy you were mentioning earlier is a way to help them learn a more healthy way to manage this?
Yeah, to look at things. And, you know, again, some people are also born more worried than others. Some are pretty laid back. And that's probably one reason why we find people who went through identical situations who are doing okay. Now, if a person's been abused as a child, and we have way too much of that, what we find is that their whole brain chemistry have been sensitized to stressors, and that can be persistent. Throughout their life, they're more at risk. Now, it's not to say they can't deal with it or overcome with it, but we know that it makes it much harder. We know, for example, going back to the military situation, that younger men appear to have greater predisposition to PTSD, and this is regardless of war exposures, than older soldiers. If you're less educated, there's a greater risk. Certainly if there's substance dependence, again, like alcohol or any other drugs, which hopefully is not the case. Lower rank appears to place people at greater risk.
Is that because they're placed in greater danger?
And some people argue that they may be in greater danger because of the positions they're in. And sometimes, though, I'll see or you'll talk to officers who have a great deal of guilt, like a survivor guilt that we sometimes see. And we see that when people, you know, they've been in an automobile accident and one person may have died and other people may have been injured and they walk away okay. But they feel that survivor guilt. Why did I make it? Why did the Lord let me survive? And these other people suffered. And so that can be very hard, too, at all levels. And then we're not sure exactly why either, but there may be a greater risk as well in the military for American Indians who have served, African Americans who have served, to have some of these reactions. We know that PTSD, again, can occur prior to deployment. You know, like I said, in one big study, what they found is that 5 to 9% of people who were in the Army, for example, had some PTSD symptoms prior to even being assigned to Operation Iraqi Freedom. And then when you look at the percentage of people who served, it jumps up and asks questions in terms of how frequently were they exposed to traumatic events that would qualify for that, what we talked about earlier. It was right around 3/4 of the people had been exposed to traumas, but most of those did not have full PTSD.
So these people that had symptoms of PTSD before being deployed, they were they deployed previously, or is it more fear of the unknown?
Well, a lot of times it can be, again, the childhood experiences, adolescent experiences, things like that. And sometimes it may have been other deployments as well. But I think the important thing is there are ways to, and the military's done a pretty good job of this when they've been working at, they have clinical practice guidelines for managing PTSD. So they start out with an initial evaluation or triage and some checklist and a physical screening for PTSD.
Right.
If you don't have symptoms, then you go on. If you happen to have it, then they take a look to see if you meet criteria for being referred for treatment for acute stress disorder or acute PTSD.
Right.
And then they will try to frequently work with the families and health professionals to get people feeling better so that they can then go back to service or...
if you don't mind, we're just going to take another break.
Absolutely.
Okay, and then we'll get right back to hear more about this. You're listening to News Talk 640 WFNC on HealthView. This is Dr. Angela Ruff, and again, our guest is Dr. Richard Weisler.